Alcohol abuse. Alcohol is an intoxicating ingredient present in wine, beer, spirit, or other alcohol-containing drinks. Around 88,000 people in the U.S. die from alcohol-related causes every year. This makes it the third leading cause of death. It is a depressant, which means that when it reaches the brain, it slows down the body system. A fast fact about alcohol is, it is a colorless, odorless, and flammable liquid. Food and grains are used to make alcohol. The liver can only oxidize about 1 drink per hour. Alcohol is known to be harmful to the developing brain. The University of West Virginia suggests people experience the following depending on individuals. In 1 to 2 drinks, the person feels relaxed and less inhibited with a slower reaction time. Alertness is reduced to an extent depending upon every individual. In 3 to 4 drinks, fine motor skills, reaction time, and judgment are reduced. In 5 to 7 drinks, vision, perception, reaction time, and judgment are affected. The person becomes argumentative or emotionally irrational. In 8 to 10 drinks, person may stagger, speech becomes slurred and vision blurred. Motor skills are severely affected, feels nauseated or vomiting. Over 10, the person may lose consciousness or be conscious but unaware of what is happening. Increased risk of blackouts, especially on an empty stomach. Alcohol intolerance. Alcohol intolerance is people feel unhealthy and unwell immediately after drinking alcohol. It means they have an intolerance, sensitivity, or allergy to alcohol. Symptoms include facial flushing, nausea and vomiting, low BP, and diarrhea. Alcohol with depressant medication affects respiratory and CNS. Dangerous to mix alcohol with ketamine, tranquilizers, and sleeping pills. When the amount of alcohol in the blood exceeds a certain level leads to alcohol toxicity. Drinking with meals result in fewer side effects and less intoxication. Alcohol addiction. Alcohol addiction is a disease characterized by a strong craving for alcohol. If a person stops drinking, they will experience withdrawal symptoms if a person consumes a large amount of alcohol regularly. Their tolerance increases and the body requires more alcohol to achieve the desired effect. Signs and symptoms of withdrawal generally occur between 4 and 72 hours after the last drink. Symptoms include mild traumas, insomnia, anxiety, and depressed mood. Hangover. A hangover is an effect of alcohol on waking up after heavy drinking last night. Symptoms include headache, dry mouth and eyes, restlessness, and nausea. Many people will take a drink to stop the discomfort of withdrawal. In more severe cases, the person may experience body tremors, hallucinations or changes in mental stability, confusion, extreme sleepiness, and seizures. How to reduce the hangover effect. Eat nutritious food as an antioxidant and foods aids recovery. Eat food to raise blood sugar levels such as bread. Fructose in fruits helps the body breaks down alcohol. Sleep and resting help speed up recovery. Medications such as NSAIDs and antacids relieve hangover symptoms. Avoid drugs that contain acetaminophen. Healthcare professionals do not recommend drinking more alcohol to relieve hangovers. Effects of alcohol use. 1. Long-term alcohol abuse causes liver diseases like ascites, jaundice, portal hypertension, and edema. 2. Pancreatitis. 3. Cardiovascular problems lead to heart failure. 4. The emotional disturbance may develop suicidal tendencies. 5. Accidental serious injury or death. 6. Stomach ulcer. 7. Immune system dysfunction. 8. Brain and nerve damage. 9. Alcohol withdrawal syndrome. 10. Certain cancers include breast cancer, cancer of the mouth, throat, and esophagus vitamin deficiency. 11. The mouth, throat, and esophagus vitamin deficiency. 12. Mental health problems such as anxiety and depression. Management. Individual and group counseling, medications, and participation in support network such as detoxifications programs. Medications for withdrawal symptoms include tab nitrate or nitrazepam 10 mg/BD for 15 days. Capsules Bicoxine B complex 1 odd for 30 days. If associated with depression, add capsule Boftal 20 mg odd for 30 days. If the patient is violent and aggressive, add tab Serenus 5 mg/BD. Treatment of associated liver diseases like ascites, jaundice, portal hypertension, and edema.